Reports indicate that the cholera death toll in at least 60 Somalia, at least 60 in Somalia amid new cases of infection. My question to you is, how severe is the outbreak, and what are some of the major causes of the hike in infections and deaths?
Thank you very much for having me on your program. The reason why we have the spike in this cholera outbreak that we see this year in Somalia has largely been due to the impact of drought that we had for the last 2 years that actually pushed people to the brink of famine, and the devastating floods that we have received late last year in 100 years type of El Nino that has displaced more than 2.4 million people affected, and then displaced about 1.2 million people. This El Nino has actually destroyed a large number of drinking water sources as well as sanitation. And to remove all these obstacles from people who have been depending on these essential resources has just proven very difficult. That's one of the main reasons. That's the reason why we see a lot of cholera outbreaks in about 28 districts of Somalia out of 74 existing. And the coping mechanism of especially those who are displaced in large number of camps is just proving to be extremely challenging. Those are some of the reasons. And in addition to the decade-long conflict that has been witnessed in Somalia, is also restricting lots of humanitarian and development partners to have a sustainable solution to the challenges of drinking water supplies, to the displacement, as well as we all know that Somalia is a semi-arid region, and the impact has just been compounding.
I'd like to pick up on that phrase, sustainable solution. The question that we continue to ask is, what is the government and its partners doing to help curb the spread of cholera in the country? Or should I say, what else needs to be done?
Yeah, government, Ministry of Energy, Water Resources, with Federal Ministry of Health, WHO, UNICEF, and large number of partners, including OCHA, have embarked on making sure that we are looking at the hotspots, chlorinating lots of large water supply systems, training communities, health workers, and having case area targeted initiatives at the moment. And then we have an epicenter of cholera task force at national and subnational level, where we could reach wherever is possible. But at the moment, the curve is declining, and a lot of response has been organized thanks to some of our donor communities. And the case that we have seen in spiking from the beginning of the year, which was about 60 fatalities compared to 46 the entire of 2023, is actually easing down a little bit. And the government is playing a very active role. Ministry of Health, Water and Sanitation partners, WHO, OCHA, and all humanitarian agencies, including the humanitarian country team, is trying to see the containment and the break of this cycle for this dry season.